We keep hearing that the NHS is underfunded and understaffed, but I've got some stats here suggesting that actually the NHS has more money than ever. We know that it's better funded than a lot of its European counterparts. And in terms of staffing, we've got 15% more junior doctors, 9% more consultants and 8% more nurses than before the pandemic hit in March 2020. So is this an issue of staffing and funding, or is it something else?
Well, it's an issue of staffing and funding across the whole of the health and social care system. The problem with your statistics is that they look only at the NHS rather than the wider health and social care system. And it's not by any means the only issue, but one of the issues we're facing this winter. And indeed, we, in truth, face pretty much every winter, but it's worse this year, partly because of a severe flu epidemic and partly because of the extra effect of COVID. But one of the effects is that the reductions in the level of support provided to elderly and disabled people through social care means people end up in the health service or can't get out of NHS hospitals. They end up there when they don't need to be, or they're stuck in NHS hospitals, unable to be discharged. So we need to look outside the NHS itself at the broader health and social care system. It's partly a matter of the thing not being joined up. It's also a matter that there is a weakness in social care through both staffing and funding.
And we know that the social care issue has just been sort of kicked as a can down the road by government after government. What sort of serious reform of the social care sector could this government bring in the next 4 or 5 years that might make a material difference to the situation that we're seeing at the moment?
Well, the truth is social care, when it's properly funded, works reasonably well. It can always be improved. Of course it can. But the support, when we have, as we all know we do have, rising elderly population, rising population of people who need support to lead normal lives in the community, then cutting back the support, the funding and the staffing in social care as I say, it leads to problems in people's lives, and it leads to unnecessary and avoidable pressures in the health service. One of the issues, of course, in social care in particular, in the health service as well, is the fact that there is a shortage of skilled nurses, skilled social care support workers, partly because of the effects of migration controls. And that's something the government could act on very quickly indeed if it chose to.
I mean, another problem that we're highly aware of is that the GP crisis. There was a shocking statistic in the Times today suggesting that 30% of people who tried to get a GP appointment in the last year failed to do so and then either ended up treating themselves or going into A&E, which is, of course, putting enormous pressure on our already highly strained A&E services. Labour brought in reforms that meant that GPs could work fewer hours. Do you think that's contributed to the problem? Does there need to be some sort of reform of the GP services before we can tackle the problem head on?
Well, it's not a question of doing one thing before you do another. It's a question of recognising that in the wider health and social care system, as I keep emphasising, it's partly about social care. You're absolutely right. It's also about the pressures in primary care. And through GP services, through better use of other parts of the primary care system, notably pharmacies, so that people can have ready access to the right level of support. It's unhelpful, I think, when people say or imply that the only way you can get healthcare support is by seeing a GP. That's nonsense. You can go into a pharmacy and high street pharmacy. And one of the things we're not good at in Britain is using the skills that we pay to train people to have. And a perfect example of that is pharmacies, where too often you can go and see a pharmacist. Pharmacists can tell you what the problem is. Pharmacists can tell you which drug you need from the prescription-based system. But the pharmacist can't write a prescription. So you then quite unnecessarily, in reality, need to go and see a GP to get a prescription in order that you can get the medicine that the pharmacy told you needed in the first place.